Activists and members of parliament want a surgeon, Christopher Bingi, the doctor allegedly responsible for the death of Florence Nakamia, to be tried. The late Florence Nakamia had been getting her antenatal care at Health Center 4 and eventually came for delivery, but due to obstructed labor, she was reportedly advised by Dr. Bingi to either pay $250,000 to fuel the ambulance to the main referral, Mulago Hospital, or opt to pay 90,000 shillings for delivery at his nearby clinic.
One doctor called Bingi, who is a surgeon within the health facility, came up and told her that she can actually deliver provided she goes to his owned clinic, which is called Trinity, at a fee of 90,000 shillings. She said she would be paying the 90, but she was taken to the clinic and the doctor never appeared.
The deceased and her mother-in-law opted for the nearby clinic, but after hours of waiting, the doctor never turned up and Nakamia breathed her last.
Konzikalisebo ne mugamba ndozijja mukolako bulungi sebo onosobola omutereeza ko ye ajja sobola sindika kuba engeri gye yazaalako ajja sobola.
At a news conference in Kampala, the Center for Health, Human Rights and Development called for justice for her family and says her constitutional rights were violated in spite of following all the stipulated maternal guidelines.
Many rights here were violated. The right to freedom from inhuman and degrading treatment, which this woman went through, and his family, and the child that she left behind.
The family, together with the rights organizations, are also demanding for compensation with immediate effect.
The doctors and the government itself learned that impunity no longer has place in the healthcare system.
In a related development, legislators present also vowed to table a bill which prohibits government health workers from owning private health facilities.
He says, no, we cannot manage you here, but we are referring you to a private clinic for money. This is very dangerous. We must stop with this.
Sure that we inject funds into the maternal health sector. We are talking of
the area MP says the district was allocated 45 million shillings for health instead of the requested 130 million shillings. Worse still, the health center has 12 beds, yet the structure is meant for 4. Nakamia Florence is not the only mother who was referred to Dr. Bingi's Trinity Clinic. Nakaguza Annette and Tumsime Claire are among the other women.
Michael Mubangizi and wife Jennifer Musimenta, whose child disappeared at Mulago Referral Hospital, say the family is traumatized and psychologically tortured every time they look at the other child.
Musimenta says that I gave birth to 2 girls, but I was only given 1. I was denied my child or its body, and they even denied me my medical records.
Because I have too much pain. For us, we don't sleep, we don't eat, thinking about our lost baby.
Civil societies on health and human rights want to assist the family to file a case in court against the office of the executive director, Mulago Referral Hospital, for human rights violence. They want compensation and justice prevail in this case to reduce cases of maternal mortality in Uganda.
Give them a body after 3 days, a body that does not even belong to them.
But we intend to have declarations on the rights violated, declarations on access to accessing health information.
And then you find that whoever did an act or omission in itself is inhuman, cruel, and degrading in itself. These are serious human rights violations that are occurring in the healthcare setting.
However, the public relations officer Mulago Referral Hospital refused to comment, saying the matter is before court. Robert Bwaita, UBC News, Kampala.